Hi, my name is Shannon Cleveland. I used to receive SSI benefits, but then I went to work full-time. I was happy to give up my cash benefits for a paycheck. Now I have a lot more money, and even though I work full-time, I still receive Medicaid, including waiver services. My job is to help people with disabilities who want to work. I explain how their Social Security and SSI benefits will be affected by working. Both Social Security and SSI have special rules called work incentives to encourage people to work. However, the rules are complex and the rules for Social Security are different than for SSI. Sometimes there are other rules for Medicaid programs like waivers. Because the rules are complicated, you should always get one-on-one counseling before you start working. Counselors like myself provide expert advice at no cost to you. We'll help you avoid problems with Social Security and DHS that could possibly arise. We can also help you keep more of your money. Many people don't realize that Social Security can deduct some of your work expenses. For example, if you drive to work, sometimes Social Security can deduct some of your mileage and transportation costs from your earnings. That can help you keep more of your benefits. Work incentives can even help you pay expenses related to working, such as buying a car to work, job training or education, a computer for school or work, tools for work, or even starting your own business. Be sure to call, because working not only helps you financially, but it gets you out into the community and it gives you the satisfaction of a job well done.
Hello, I'm Leonard, Boyle, Executive Director of the Governor's Commission on People with Disabilities. I'm very familiar with work incentives because I've used them myself. When I first went back to work, I worked part-time and continued to receive my full Social Security benefits. When I went to work full-time, I knew I'd have to give up Social Security benefits, but I'd have more money and better health care coverage. One of the keys to succeeding in employment is work incentives counseling. Very few people in Arkansas are qualified to provide counseling. I recommend calling the Employment Sources Hotline. They will put you in touch with the counselor in your area. A work incentives counselor can also tell you about the Ticket to Work program. Ticket to Work lets you choose an employment agency to help you get a job. Social Security will pay the agency if you get a job and earn over a certain level. There's no cost to you. Ticket to Work also helps you avoid Social Security medical reviews while you're going to school or supporting yourself by working. That makes it easier to keep the benefits you need while you're getting started. Some people worry about losing their food stamps when they start working, even if they don't get much. It's true that if you work, your food stamps are likely to stop. On the other hand, you'll have money to buy more groceries, including items you're not allowed to buy with food stamps. Once you start working, you may also qualify for new benefits such as the Earned Income Tax Credit. The tax credit is only available to low-income people who work, especially parents with dependent children. You could qualify for a tax refund check even if you don't have any federal income taxes withheld.